Okay, so we will go ahead and get into health psychology. Let me make sure that everything is going here. All right, so just to start out, health psychology is a branch of psychology that takes a look at the psychological factors that are related to wellness and illness, including like the prevention, diagnosis, and treatment of medical problems. So this is when we cross over into that. Then we have psychoneuroimmunology, and this is the study of the relationship between like psychological factors, the immune system, and the brain. So we're basically integrating psychology into medicine. And studies, basically within health psychology, they're starting to look at, or they do look at how people stay healthy, why we become ill, and how we respond when we get ill. And here's the World Health Organization definition of health in 1948, which is the complete state of physical, mental, and social well-being, not merely the absence of disease or infirmity. And so, wellness is the optimum state of health. So, the focus of health psychologists specifically is to promote health and maintain it, prevent and treat illness, and determine the origins or causes of illnesses as well. Basically, improve the healthcare system and to help formulate health policy. All right, so we're just going to cover a couple of different concepts in health psychology. Obviously, this is a pretty vast area of study, but we're going to take a look at stress. So, how's health psychology a union between medicine and psychology? And what is stress? How does it affect us, and how can we best cope with it? So, stress. This is going to be your response to events that are threatening or challenging. And these are going to be unique to every single one of us. Something that might stress one person out may not stress someone else. And stressors are those circumstances and events in life that produce threats to our well-being. So, basically, this is a daily thing. It's a repeated sequence of perceiving a threat, how do we cope with it, and then adapting to it with greater or lesser success. And again, we're going to go through like what are hassles, stress, traumas in the following slides. And the attempts to overcome stress can ultimately result in health problems if they are not effective. So, if our coping skills aren't great, then the outcome of handling that stress might not be so positive. So, initially, we had the biomedical model, and this biomedical model stated that illness could be explained through aberrant somatic bodily processes. So, looking at the physical nature only of illness, like the biochemical imbalances, neurophysiological abnormalities. So again, it's body-based. It assumes that psychological and social processes are not related to the disease process. So again, we're looking at a unidimensional model of illness or health, which, as we know, is probably not effective because it reduces illness to low-level processes. Again, just those biological, neurological processes, and it fails to recognize those other processes that are very influential, that are social and psychological. It also emphasizes illness rather than focusing on things that enhance health. So we're only looking at the negative and not necessarily enhancing the positive. And this can't address the issues that face practitioners. So again, if six people are exposed to the flu, why do only three get it? There has to be something outside of just this biological structure that can impact that. Again, there isn't there are large correlates, but again, not necessarily anything that is causal. So, health and illness are consequences of the interplay of biological, psychological, and social factors. So, just like we talked about in the psychological disorders chapter, we use a biopsychosocial model of health and illness. And the advantages of this, as we talked about in the psychological disorders chapter, are that we maintain the macro level and micro level processes continually interact to influence health and illness. So we look at the micro level processes within our body and then the macro level on the social level even. And it emphasizes both health and illness, so both sides of that pole. And understanding the interacting role of biological, psychological, and sociological factors is going to help inform diagnosis. And it emphasizes the relationship between the patient and the practitioner, improving whether or not they use those services, how effective treatment is, and how quickly that illness is resolved. So here's just an example of using the biopsychosocial model. So again, show how the mind and body are intertwined in health. For example, this did happen. There were sudden nocturnal deaths among male refugees from Southeast Asia after the Vietnam War. And here's the thing is they occurred in the first few hours of sleep, and the autopsy showed there was no specific cause of death. So, if that's the case, we can't just rely on the biological explanation, showing like, oh, well, I guess it's nothing. Well, it was something. There were many of these. So, to take a biopsychosocial approach, they found that it was due to a combination of genetic susceptibility, chronic strain of adjustment to life in the US, and the immediate trigger. So, and some sort of immediate trigger. So, for example, family argument, violent television, frightening dream. So, again, there's some sort of genetic susceptibility, the strain of, again, relocating to the United States, being in a strange place, and then some sort of immediate trigger. And so this shows the interplay between, again, that biological piece, the psychological piece, and then the social factors of being in the United States. Okay, so there is a need for health psychology. There has been an increase in chronic or lifestyle-related illnesses, because until the 20th century, illness primarily was caused by acute disorders like tuberculosis or influenza. But now chronic illnesses are the main contributor to disability and death, things like heart disease, cancer, and respiratory diseases. And so, in regard to this, okay, so the nature of stressors, like my stress is possibly your pleasure. So, certain kinds of events are universally stressful. Other situations may or may not be stressful to certain people. Again, something that stresses me out may not stress you out. So, to find an event stressful, somebody must perceive it as threatening or challenging and lack the resources to deal with it effectively. So, again, for it to be stressful, again, those immediate positive coping skills are just not necessarily there, turning it into a stressor. And so, the interpretation is really key in regard to do you perceive this as a threat or not? So, for example, maybe your boss asks you to have a meeting next week. Do you perceive that as something that is threatening and something to be feared or not? And again, everybody's going to perceive that potentially differently. And also there are other, contexts as well that would play a role. But here, for example, okay, so the COVID-19 caused a lot of stress and anxiety, and this survey indicated this, and this was just among college students. So I don't have the sample size, but 90% of college students in this study indicated that it did cause stress and anxiety. About 80% experienced disappointment, sadness, loneliness, or isolation. A little less than 50% found it to be a financial setback, and about 55% actually had to relocate because of this. So you could see that, again, something like COVID-19, which we do know, caused immense amounts of stress. You can see how it factored into college students' lives. And so when it comes to stressors, we can categorize them to a certain degree in that there are cataclysmic events. So these are strong stressors that occur suddenly and typically affect many people at once. The floods that happened several weeks ago, COVID would be an example, 9/11 would be an example. A tornado would be an example. But again, they come out of nowhere necessarily. And again, a lot of people experience them. Personal stressors, major life events that have immediate negative consequences that generally fade with time, death of a family member, maybe you're laid off from work, maybe you break up with a significant other. Also, background stressors, these are going to be your daily hassles, everyday annoyances, okay? Being stuck in traffic, that cause minor irritations and may have long-term ill effects if they continue or are compounded by other stressful events, or that classmate or coworker that just bugs you and is just annoying, or you spilled your coffee, or somebody cut you off in the lane you were driving in. Um, just the basic things. Maybe somebody honked at you. Again, those are just going to be your daily hassles you run into every day. But again, as those compound, they do add up. The flip side of this is going to be the uplifts. Um, which are going to be, again, basically it's looking at like risk and predictive or protective factors. So the things that just give you a little bit of a boost, something like your favorite song comes on the radio, or maybe you didn't spill your coffee, or somebody brought really good coffee in, or maybe somebody brought treats in today. Those are the things that kind of that provide an uplift and even out those stressors or daily hassles. So some of these daily hassles, these are some of the most common ones. This was from 1990, though, just so we're clear here. Let's see here. Yeah, so not having enough time. I think that is probably similar to this 30 years ago, 35 years ago. Too many things to do. Troubling thoughts about the future. Too many interruptions, losing things, family members' health, social obligations, concerns about standards or social norms or what is expected of you, concerns about getting ahead, and too many responsibilities. So I think to a certain degree we could all still probably um, relate to this. And then with this, the uplifts are from 1981. So this may be a little bit different now, but in general, it's still probably fairly relatable, but relating well with your spouse or a lover. So getting along with the person you're married to or the person you're with, getting along with friends, getting something done, feeling healthy, sleeping enough, going out to eat, getting things done that you need to get done. I was visiting, it says phoning, texting, emailing, FaceTiming, snapping, or writing someone. Spending time with your family, and basically with the home pleasing you. So this could be like your dorm room, like you have it set up the way you like, you have your decorations just right, it's organized like you like. That's actually an uplift. Okay, so in regard to, okay, further categorizing stressors, yes, members of racial or ethnic minority groups often experience high levels of personal stressors as a result of things like systemic prejudice and discrimination. And some victims of major catastrophes, cataclysmic events, and severe personal stressors do experience PTSD. Now, just as a note, PTSD as a diagnosis currently is pretty narrow in nature. Um, but it it can still be applied. You can still apply traits of it, even if you haven't experienced exactly what is required, or it may be complex post-traumatic stress disorder. But post-traumatic stress disorder, it is a phenomenon in which victims of major catastrophes or strong personal stressors feel long-lasting effects that may include re-experiencing the event in vivid flashbacks or dreams. And these flashbacks and dreams, it might be triggered by an otherwise innocent stimulus, but it is commonly experienced by victims. Oh, I'm so sorry about that. I just picked up my DSM to explain this. That probably got your attention. Might have been traumatic, actually. I was going to look at the PTSD diagnosis. There is to just tell you basically what I was just explaining to kind of give you context. Yeah, soldiers, victims of rape, those that experience terrorist attacks, mass shootings, law enforcement officers, any sort of first responder. But when it comes to PTSD, let me see what I got here. Yep, they're not going to include it in here. So with PTSD, just to give you an idea, if you're interested, you have to be exposed to an actual death or a threatened death, serious injury, or sexual violence in one or more of the following ways. So this is where it's kind of narrow, because you either have to directly witness or experience, or you directly have to experience a traumatic event. So maybe you were threatened. Um, Death was threatened upon you. I don't know how else to say this. There was a serious injury threatened, or sexual violence, or you incurred those things, or you witnessed it actually happen to others. Maybe you saw somebody get shot in the head. You learn the traumatic event occurred to a close family member or close friend. So this could be an example of like, and I know this is a little outside of most of your lifespans, but if you were alive during 9/11 and you found out one of your family members was in one of the towers. And then also experiencing repeated or extreme exposure to aversive details of traumatic events. But here's the thing: this can only be this can only be work related. So if you are, for somebody that was just watching on TV and watched the towers go down over and over, didn't have anybody in it, they were not a first responder, they do not qualify for that um, criteria there. But if you're a first responder, if you're if you're a police officer responding to traumatic events, if you are somebody who has to look at crime scenes, even if it's through your through a computer or reports, that would count because it's work related. But if it's not work related, unfortunately, that does not count. And then, of course, you have to have involuntary, intrusive, distressing memories. There's avoidance of stimuli, negative cognitions, and marked alterations in arousal and activity. But I just wanted to give you those first criteria to show you what the first part of PTSD requires for you to be considered. So, again, it's fairly narrow, but that should not minimize anybody's stress or trauma. Because even if you do not qualify for a diagnosis of PTSD, you can still obviously get treatment for your symptoms related to it. And that goes for stress, trauma, all of it. But stress produces both biological and psychological consequences. There are psychophysiological disorders, so things like medical problems. This can be influenced by an interaction of psychological, emotional, and physical difficulties. And stress affects us in a variety of ways. It increases the risk that we get sick. It can hurt our ability to recover from disease because it influences our immune system, and it reduces our ability to cope with future stress. So here is, and you are welcome to, this is in the PowerPoint. If you want to take a look, find out how stressed you are. This is just a simple stress assessment. Okay, so in regard to stress, still, we have what's called the general adaptation syndrome. This is a theory that was developed by Seil that suggests that a person's physiological response to a stressor consists of three different stages. So initially, there's alarm and mobilization. You become aware of the stressor, and then as a result of that, your fight or flight system goes off, obviously your sympathetic nervous system. And as a result of that, again, you're in fight or flight. There's then resistance. The stressor is going to persist and the body is going to fight the stressor. And again, you use a variety of means to cope with this. Now that you have been, your fight or flight system has been elevated and activated. Now you're in that state. The stressor continues. What happens now? Some people, again, this is the coping piece. Maybe some people can positively cope or effectively cope. They start to, again, mindful activities. Maybe it is deep breathing, removing themselves from the situation, taking a walk. I'm just throwing everything I can out there. But maybe some people don't do it. Maybe they just put their head down and continue forward. Again, that's not depleting that stress at all. And what happens then sometimes is what's called exhaustion, is that the resistance is inadequate. Maybe we tried to cope with it, continue through it. Obviously, there are a lot of negative coping techniques, but the ability to fight the stressor declines, and negative consequences can result like illness and psychological symptoms. So you may have like anxieties that develop, or you might get sick because that stressor has not decreased and or dissipated, and so you are left in that state of fight or flight. Okay, and here is this model. And then we have psychoneuroimmunology. And this is the study of the relationship among the psychological factors, the immune system, and the brain. Contemporary health psychologists that specialize in this have identified three main consequences of stress: direct physiological results, behaviors that are harmful to health and well-being. Again, the physiological results, I mean, this could be anxiety, this could be sickness, this could be like tension, behaviors that are harmful to health and well-being, drug use, drinking, and indirect consequences of poor health-related behaviors. So some of those physiological effects: elevated blood pressure, depleted immune system, increased hormonal activity; harmful behaviors: smoking, alcohol, poor nutrition, poor sleep, increased drug use. Then the indirect health-related behaviors: not listening to your doctor, not seeking your medical advice. Let's see, increases in delays seeking medical advice, decrease in likelihood of seeking medical advice. So you take longer to go to the doctor and you may not go at all. Okay, so That's the last piece on stress. Okay, just a little bit about, let's see where we're at here. Chronic health disorders. All right, so when it comes to chronic health disorders, again, we're talking about long-term health disorders that are people may experience. This could be anything from cancer to rheumatoid arthritis to chronic pain, um, heart disease. But again, this is going to be a long-term disorder of some sort. And in general, yeah, there may be the emotional response of denial, and you avoid what this means for you. And it interferes with actually absorbing or internalizing treatment information, and it can get in the way of your health if you just deny that it exists. Anxiety, people might become overwhelmed by potential changes in their lives and the prospect of dying, and as a result of that, that can interfere with treatment too. Depression. These are all, and again, some of these are all normal reactions to devastating news. These are all normal aspects of grief. Um, and I would say if these are experienced for an extended period of time or inordinate duration of time, that's when it's going to get in the way of treatment. So again, depression, again, that's going to get in the way of making sure that you are adhering to treatment, and doctor's orders. And yeah, the pe people who do get depressed, pain and disability, negative life events, and lack social support in general. Also, some personal issues for those who are diagnosed with chronic health disorders, self-concepts, body image as well. And then also issues related to achievement, because this is an important source of self-esteem and self-concept. Again, if you were going to be diagnosed with a chronic health disorder, these are things that could very much be depleted. Same thing with social resources, which are going to provide you emotional support. And your private self, your identity can be affected by chronic health disorders because it probably will shift. Parts of your life will shift as a result of being diagnosed. And again, some strategies to cope with these chronic health disorders could be things like social support, distancing, positive focus, cognitive escape or avoidance, behavioral escape or avoidance, and strategies that work, active coping and coping by, again, using positive responses. So, and I've got some of these at the bottom. The nature of the health disorder, patients may adopt an inappropriate model for their disorder. In regard to the cause of the health disorders, they might blame stress, physical injury, disease causing bacteria, and God's will for their disorders. Like, oh, obviously God hates me or God wants me to suffer. Also, or they may blame themselves. Self-blame can lead to guilt, self-recrimination, or depression. So all of these things are just going to result in more negative affect and emotionality, potentially decreasing the effectiveness of treatment and overall outcomes. Also, the controllability of the health disorders. Those who feel they have a sense of control or like they can do this with respect to the disorder, they're going to be more adaptive. They're going to be more adaptive. They're going to be more successful. And this actually might prolong life. Also, in managing chronic health disorders, regardless of what they are, you try to, this physical rehabilitation is going to result in several goals. You learn how to use your body as much as safely possible. As a result, you're still mobile, you're still able to do certain things. There's still a certain amount of control and independence potentially available. Learning how to sense changes in the environment to make the appropriate physical accommodations. If it's cold, if it's warm, if it's windy, if it's something that might not be accessible, or maybe it is a good day, learning new physical management skills and learning the treatment regimen to follow and learning how to control energy expenditure. So again, if there are certain levels at which you possibly hit, you understand like, okay, we just need to slow down a little bit, or maybe we don't do as much today. So again, and this would, I'm sure that this would apply to a vast array of chronic disorders that one could experience. And also in developing a comprehensive rehabilitation plan, they might need a pain management program depending upon the disorder and training to use adaptive devices as well. Also, in regard to adherence, this is increased by appropriate education and predicted by high expectations for controlling one's health and self-efficacy and knowledge of the treatment regimen. That will all play a role in how well they adhere to the management of the disorder and succeed in managing it. Also, social interaction problems. You might receive negative responses from others. It might impact the family, and you might have to take or they might have to take a caregiving role towards you as well. All of this is possibly going to affect the world around you. Positive changes in response to chronic health disorders. Um, yeah, experiencing positive reactions and optimism. Like, okay, these are the things that I'm able to do, and I'm going to be able to do it this and this and this and way. Inspiration to act now instead of postponing. Again, maybe it's a more serious chronic health disorder, and so okay, I'm going to do these things because maybe you do not know how much time you have left, or acquiring more empathy and compassion because now you know what it feels like in order to, be limited in a variety of ways, but also feeling stronger and more self-assured that you are doing everything you can and you have a certain amount of control over your life and thus feel more comforted. Also, okay, so that's going to just be the chronic disorder section. So now the last part of this chapter, which I know we went through the chronic illness section. Some semesters I focus on that more than others. Hopefully, it just gives you a basic overview of the potential challenges regarding chronic disorders. And obviously, different psychological therapies are probably recommended as well. Things like cognitive behavioral therapy to address thought patterns, to change behaviors is very effective. But anyway, so the last part, the psychological aspects of illness and well-being. So how do psychological factors affect health-related problems like heart disease, cancer, and smoking? So this could be related to, I mean, this is kind of your behavioral patterns or personality types. So you might have type A behavioral pattern. These are a cluster of behaviors involving hostility, competitiveness, time urgency, and feeling driven. So you might hear that somebody has a type A personality. That would be this. Hostility is the key component. But here is this is a stat type A men develop heart disease twice as often as and suffer significantly more fatal heart attacks than those who are type B. Then you have your type B pattern. This is characterized by a patient, cooperative, non-competitive, and non-aggressive manner. And so you could possibly see just right there why type A men may develop heart disease and suffer more heart attacks, fatal heart attacks, than those who are type B, just in regard to stress. Um, Also, type D for distressed. This is behavior characterized by insecurity, anxiety, and a negative outlook, puts people at risk for repeated heart attacks. So yeah, if you're type B, you've got a better chance at not necessarily dying of a heart attack in comparison to A and D. All right, psychological aspects of cancer, the emotional responses of cancer patients to the disease affects its course, just like we were talking about with those chronic disorders. Um, so this slide is kind of just hanging out here on its own. Smoking. Smoking, maybe vaping. We don't have the best data related to vaping yet, but we may soon, and we may be talking about smoking and vaping. But smoking is the leading preventable cause of death in the US. Whether a person will become a smoker depends in part on genetics, but there's some social factors. So if it is seen as cool, and again, you could conceptualize vaping in this context as well. If you see it as cool, if other people like in the media are vaping or smoking, or if it's a rite of passage, and so like somebody goes to a party and they're like, oh, have a cigarette, or oh, try my vape. And then when people become addicted, there's a complex relationship that develops among smoking, nicotine levels, and emotions. So here's your vaping. We don't really call them e-cigarettes anymore. It is worrisome. So this is a couple years old, but so you might kind of be giggling about this because we are past this point. But yeah, nicotine is going to be harmful to adolescent brains. There are still some contaminants in vapes that have health consequences. It could cause lung damage. Again, we need more data. And then young users may be prone to smoke regular cigarettes in the future, or young users are going to be more prone to use to vape later into life. All right, so I don't know what this looks like right now. I'm assuming it might be a little bigger. or more enhanced. So the percentage of teenagers who use nicotine vaping products, again, so that teenagers who vape in the last month soared from 2017 to 2019. So I'm guessing this is much higher at this point because in 2019, seniors, 1 out of 4 seniors, 1 out of 5 juniors, or yep, 1 out of 5, shoot, freshmen, sorry about that, freshmen, and almost 10% of eighth graders. I'm guessing it's higher than that now. And again, once you start smoking or vaping, it's hard to stop. Nicotine is an incredibly addictive drug. A lot of people have tried to quit 8 to 10 times before maybe they're successful. But again, it's very common that they will relapse. Yeah, some successful approaches. You have your nicotine replacement drugs, behavioral strategies, CBT, hypnosis, and then changes in societal norms toward the habit. So if we someday decided that vaping and smoking is disgusting, that would actually result in fewer people doing it. If it is not seen as cool, fewer people will do it. And again, smoking is has decreased quite a bit in the last 30 years. Uh, but still, there are quite a few people that smoke. This is right around 10%. This is 2016. I don't know if it would be about the same now, but amongst seniors, it's right about 10%. Yeah, eighth graders, you're right around maybe 2%. Your ninth grader or your 10th graders, so your sophomores, maybe around 3%. Um, but with the advent of vaping, I still think that is decreased and vaping has replaced it. Okay, so let's see what else we have here. In regard to, yes, following medical advice. And I will say that I am guilty of this. I have been. Not all the time, but I have been. As many as 85% of patients do not fully comply with their physician's recommendations. I have gotten Z-Paks for like strep throat or other illnesses, and I have not taken the entire Z-Pak. I just quit when I felt better. That is not complying with my doctor's recommendations. Also, creative noncompliance refers to the practice of altering a treatment by substituting your own medical judgment. Like, oh, well, this was kind of helping, but if I do this on top of it or this, then this might help more. So, yeah, the tendency of many in the COVID pandemic to minimize its severity and insist on going out or not, yes, not adhering to the CDC's warning. Or it can be the result of misunderstanding medical directions. Yeah, these errors committed by patients and providers are the third leading causes of death in the US. So, that is obviously all preventable. All preventable. Okay, yep. And you need to communicate well with your provider. Physicians make assumptions about what patients prefer, or they may push a specific treatment they prefer. Doctors are going to do this. You can see this with COVID. Some doctors said, yes, please get the COVID shot. Others said, absolutely not. So that's an issue. The relatively high prestige of physicians can be intimidating. So do you really want to tell them absolutely everything? Many patients fail to ask for clear explanations because they might feel dumb, as if they're supposed to know this, even though everything medical-wise is very complicated. And in some cases, the material that must be communicated, it is too technical. So if it's too technical, I'm not going to be able to understand it, but I don't want to ask questions and look dumb, so we just move on. Yeah, so there's also e-health communication. So you could do this with physical health. You can do this with mental health as well. That is definitely making physical and mental health care much more accessible today. Let me see here. We can talk about happiness for a second. Subjective well-being. So this is something that can play a great role in increasing mental and physical health. This is their sense of happiness and satisfaction with their lives. We all experience this. People who have high levels of subjective well-being, it says happy here, but I'm going to say well-being. Happiness and well-being are different. So they have high self-esteem and might hold positive illusions that things are a little bit better than they are. That's okay, though. That's being a little bit positively delusional is okay. They have a strong sense of control over their environment and themselves, or they perceive they have control. They're optimistic. And again, men and women, they're generally made happy by same sorts of activities, but not always. So, like time with family, time with friends, completing tasks. And happy people like to be around other people. And again, that could be debated in that if you're an extrovert or introvert, there may be different things or amounts of people that increase happiness or well-being. So, that is all a little bit subjective, but I hope you get the general idea. Most people report being at least moderately happy most of the time. Again, it depends upon what you consider to be happy. I would still say have a decent level of subjective well-being. Life-altering events like winning the lottery are unlikely to make people happier than they already are. That is interesting because research has been done in regard to this, and that like there is a certain amount of money that does make people that increases happiness, but it does basically level off. And the research, and I would have to consider inflation now, but what the research showed is that happiness increases with income up to the point at which all needs are met. So, like, there's enough food in the house, you can afford your bills, you can afford housing, you can afford a car payment, and you can save a little bit of money, and then it it levels off. So now maybe just for a household, I'm not exactly sure what the median income is, but let's say right around like $80,000. I think it was 70 when this research was done. But anyways, obviously happiness went up for people until they hit that $80,000 per year, and then it leveled off. That was no different between, or not significantly different between somebody who was earning that could meet all of their needs and save a little bit of money and somebody who was making millions of dollars. And so what that indicates, again, money doesn't necessarily increase happiness. It will to if it ensures that your needs are met and maybe you can save a little bit of money, but beyond that, it does not on average increase happiness. And people's level of subjective well-being is typically stable. People have different set points for happiness, partially impacted by genetics. And even though there are ups and downs in life, most people can adapt. And you basically return to that set point of happiness. And then in regard to this, which face comes closest to expressing how you feel about your life as a whole, most people rate themselves as happy. See that over here. Nobody's over here. Fascinating. Small minority is over here, but most people are happy. Okay, with that being said, I hope that everybody has a great day. I appreciate you hanging with me this long, and I will see you soon.